Module Overview. To train you to refine, format, and tailor their CVs and cover letters for specific healthcare roles, institutions, and countries, with strong attention to layout, compliance, relevance, and personalization. This module ensures that healthcare job seekers create reader-friendly, ATS-compliant documents that showcase professionalism, attention to detail, and alignment with job requirements, whether applying for a local hospital, an international NGO, or migration-driven placements. Why finalizing and formatting matters. No matter how brilliant your clinical experience or education is, your application may be discarded if it is poorly formatted, not tailored to the role, difficult to read, not compliant with institutional or international standards. Recruiters often take 6 to 10 seconds to decide if they will keep reading. This is where final touches can make or break your opportunity. A sloppy format suggests a sloppy professional. Structure of a standard healthcare CV, global format, section by section. Layout, header, name, email, phone number, LinkedIn, optional, country of practice. Professional summary, 3 to 5 lines summarizing your expertise, specialty, and focus. Licensing and registration, e.g., NMC UK, MDCN Nigeria, NMBI Ireland, AHPRA Australia. Clinical experience include facility name, position, dates, responsibilities, and achievements. Education, list institution, degree, and graduation date. Certifications, BLS, ACLS, OS, HA, etc. Skills, split into clinical, e.g. venipuncture, and soft skills, e.g. empathy. Languages, especially important for international roles, CPD, and training. Online courses, workshops, CME credits, references, available upon request unless specified. CV formatting best practices. Feature standard font, Calibri Arial or Times New Roman, size 10 to 12. Margins 1 inch, 2.54 centimeters. All around spacing 1.15 to 1.5 line spacing. Length 2 pages for professionals, 1 page for interns/new graduates. File format PDF is universally acceptable, tone formal, active voice, clear and concise, grammar free of spelling, punctuation, and syntax errors. Tailoring your CV to a specific job. A. Read the job description. Highlight keywords, e.g., wound care, palliative care, infection control. Align your CV with the duties and responsibilities. B. Match your experience. Reorganize your experience to emphasize what matters most to the recruiter. Applying for a home care nurse role? Put community-based experience first. C. Use job-specific language, match terminology. If they say clinical documentation, you should too use quantifiable results. Reduce patient discharge time by 25% through improved pre-discharge planning. Customizing the cover letter for maximum impact. A cover letter should never be copy-pasted or overly generic. Elements of a tailored healthcare cover letter, section content salutation. Use the hiring manager's name where possible. Introductory paragraphs state your interest, and the job title, middle paragraphs. Highlight relevant experience, achievements, and soft skills. Tailored statement. What I bring to your facility. Address the employer's mission/values. Closing, express gratitude and readiness to discuss further. Use the STAR format, situation, task, action, result, to describe scenarios. International considerations. UK NHS, use chronological CV, most recent experience first. Include GMC, NMC registration number. Include right to work status if applicable. USA, emphasize procedural competencies. IV access, ICU care, documentation. Include state licensure or NCLEX status Canada. Ensure alignment with NOC skill level and duties. Highlight bilingual capacity if applicable. Australia, mention APRA registration or eligibility. Demonstrate compliance with APRA Code of Conduct NGOs, WHO, Red Cross, MSF. Highlight multi-country work experience. Emphasize intercultural skills, language proficiency, and emergency care capacity. Common final mistakes to avoid. Mistake correction. References available on request, on a first-time application. Only include, if specifically asked, spelling the hospital name wrong. Triple check organization names. not saving as PDF. Always export CV and cover letter as PDF. Using one generic CV for every job. Always tailor to the job. Listing outdated or irrelevant courses. Remove expired non-healthcare related credentials. Accreditation, alignment, and compliance. This module aligns with the application standards and documentation compliance requirements of World Health Organization, WHO, Global Recruitment Guidelines, UK NHS Job Application Standards, Nigerian MDCN, and NMCN Guidelines, Canadian Immigration Credentialing Standards, ICCRC and NOC, AHPRA, Australia, Application and Resume Guidelines, USAID and UN Job Application Practices, ICN, International Council of Nurses, Ethical Application Practices, EU Blue Card CV Formatting and Qualification Evidence, your Finalization Toolkit. By the end of this module, you will have a 2-page, ATS-compliant, PDF CV, one customized cover letter for a real job application, knowledge of tailoring content to international roles, a proofreading and formatting checklist, compliance with data protection and ethical presentation standards. Conclusion. A well-tailored and polished CV and cover letter is your personal advertisement to the healthcare world. It must not only pass through automated filters, but also resonate with human reviewers who are scanning for fit, relevance, and professionalism. You are not just applying for a job, you are offering your values, ethics, care, and excellence to someone's hospital, clinic, or community.